Hey everybody, Dominic here, and I wanted to do a quick video demonstrating one of our most recent telehealth scenarios. So this scenario is utilizing AI generated text, audio, and imagery in order to create telehealth nursing scenarios that students who are studying in this topic can explore. So I'm going to start the simulation here, and I'm going to jump straight into the overview where we can hear from Nurse Sandra, who's going to introduce the scenario for us.
In this final telehealth visit with Mr. Alejandro Hernandez, the focus is on evaluating his learning and ability to self-manage his chronic heart failure. Key topics include assessing his knowledge about monitoring for signs of potassium deficiency, evaluating his daily logs of blood pressure and weight for indications of fluid retention, and utilizing the teach-back method to determine his understanding of heart failure management. The nurse will aim to create an open dialogue where Alejandro feels empowered to share concerns, ask questions, and take an active role in his care. Determining additional educational needs and collaboratively setting a plan for the next steps will also be vital.
Okay, so as I said, what you just listened to there was content that we leverage large language models in order to generate that introduction and then use separate generative AI technology in order to create a synthetic voice that spoke that content. And of course, we can see Nurse Sandra, and if I proceed, we can now also see Alejandro, who's going to be the subject of this scenario. So let's listen to their conversation.
Good morning, Mr. Hernandez. It's Sandra again. Today I'd like to follow up on the self-monitoring we've been working on. Have you noticed any muscle weakness, cramps, or changes in your heartbeat?
Well, last week I had some cramping in my legs at night. Sometimes my heart felt like it was fluttering. I feel okay today, though.
Okay, so we actually utilize different voices, as you can hear, for the different people in the scenario. And that obviously brings another level of authenticity to these scenarios that students go through. So we've got the first part of this telehealth phone conversation. And if I proceed, this is the first decision point that a student is faced with. What is the most important follow-up action for the nurse? Okay, and so we have different options here. If I were to choose an incorrect option, it will say, well, why don't we try that again? And it actually indicates to me why this is not the best choice. If I proceed, it gives me another opportunity to answer the same question. Now this time, I'll choose the correct answer. Ask Alejandro if he's been taking his potassium medication. I'll click on that. It says correct. The nurse should begin the assessment by determining if Alejandro is taking his potassium supplement as prescribed, because these can be symptoms of a potassium deficiency. Okay, so I got a little bit of rationale for my correct answer. I'll proceed to the next stage, and let's hear the next part of the phone conversation.
Actually, I forgot to take them for a few days last week, but as soon as I remembered, I started taking them again every day.
I'm glad you remembered to start taking them every day. We want to keep you out of the hospital if we can. I see your provider ordered some lab work for tomorrow, so we'll see what your potassium levels look like. Let's look at your blood pressure and weight logs. Have you noticed any sudden increases in your weight recently?
I think I gained 3 pounds over the past week.
Okay, so now we got some additional information to consider, and if we proceed, we'll go on to the next decision point. What is the most appropriate response by the nurse? Okay, once again, we're provided some different options here to consider. I'll choose this option here. Ask Alejandro to continue monitoring his weight daily and to notify his doctor about the 3-pound increase. Okay, that's the correct choice. Monitoring his weight daily and notifying the doctor about weight increases is the recommended course of action, as this can indicate fluid retention requiring medical intervention. I think it's important to highlight that all of this content that we developed, the overviews, the learning objectives, the dialogue between the nurse and Alejandro, the questions, the answers, the rationales, all of that was created through the help of large language models. Large language models that were then leveraged by our subject matter experts in order to ensure that the final product is objectively accurate. And by using these technologies, we've been able to create these scenarios with so much more efficiency than we ever could before. Honestly, these scenarios would not have existed if we didn't have the AI technologies that we've been using, because we just wouldn't have the capacity. The efficiencies that this affords us are simply incredible. So I'll proceed to the last portion of the conversation.
A 3-pound increase in your weight over a week could indicate fluid retention related to your heart failure, so let's plan on reporting this to your physician as well as the other symptoms you mentioned. You're doing great at monitoring your symptoms. To evaluate how well I've explained things, please explain to me your daily process for monitoring your health.
Let's see, each morning I weigh myself and write it down. I take my blood pressure and write that down too. I watch for symptoms like swelling, cramping, or heart fluttering, and I make sure I bring my logs to the next appointment and call you and my doctor with any new symptoms. How's that?
Excellent. You've summarized the key points perfectly. It seems like you have a great understanding of your daily self-monitoring routine and what to report. This will really help us work together to manage your heart failure and stay healthy.
All right, and I'll proceed to our final question. What is the primary purpose of asking Alejandro to summarize his daily self-monitoring routine? Okay, I'll choose the option here, to identify topics that need additional teaching. And yes, that's the correct answer. The primary reason for using the teach-back method is to identify knowledge gaps that require additional teaching. All right, so that's the conclusion to this particular scenario. And again, I just wanted to share this because by using these different AI technologies, it's not just a matter of we're able to create learning content at such a much more rapid pace than we ever could before, but by combining these technologies, we can create them in a much more engaging manner. And as we look forward to thinking about how AI is going to augment the learning experience, I think it's worthwhile to explore what these technologies can do and really think creatively about how we can leverage them. Because honestly, the possibilities of what we're going to be able to create in the future are massive. And these technologies are only going to get better. So I think it's pretty exciting. So anyways, I hope you enjoyed, and thank you for watching.